Over the course of our trans journey, we have options that we can choose from. Going on HRT is definitely one option, but another option that goes along with that is taking progesterone. So for this episode of Stacy Links Presents, I'm going to talk about progesterone. When I come back. Alright, so welcome to my channel. I'm Stacy. And in this episode of Stacy Links Presents, I'm going to talk about progesterone. I'm going to talk about what it is. I'm going to talk about how it affects us, what it does, and some of the side effects that you may experience on it. So what I'll get you to do before I get started, if you're new to this channel and you're a transgender person or a member of the LGBTQIA+ community, or even just an ally, make sure you go down below in this video and hit that subscribe button. I have videos and playlists of the last 3 seasons on my makeup routines, product reviews, fashion, and jewelry that you would love to see. Plus, I'm documenting my transition as a solo parent and advocating for the LGBTQIA+ community. And also, if you're not following me on social media, make sure you check the description below in this video for all my social media links and go follow me on there. Alright, so progesterone is an optional hormone that a trans woman can take while on HRT. There are many benefits to taking progesterone while on estrogen therapy. I have several articles that I would like to go through, and I will talk about what progesterone is, what it does normally, and then what it does for us. So first, I have an article from the Cleveland Clinic on the definition of progesterone. In women or people assigned female at birth, progesterone supports menstruation and helps maintain the early stages of a pregnancy. Too little progesterone can cause complications with pregnancy or produce side effects similar to menopause. So here's a basic explanation on what progesterone is and what its main function is in the female body. So progesterone is a very important hormone in the female body to support her menstruation cycle and to help during pregnancy. When a woman becomes pregnant, their progesterone levels will start to spike to help support the pregnancy. And this article here explains all of that. If you're curious about any of that, I'm going to put the link in the description below here. Alright, so this next article I have comes from the Journal of Clinical Endocrinology and Metabolism, and it is entitled Progesterone is Important for Transgender Women's Therapy, Applying Evidence for Benefits of Progesterone in cis women. This article goes through and talks about the benefits of a trans woman taking progesterone alongside estrogen therapy. The recent Endocrine Society Clinical Practice Guidelines for Gender Dysphoric, Gender Incongruous Persons advise clinicians to maintain sex hormone levels within a normal range for a person's affirmed gender. Every normal fertile menstrual cycle in a cisgendered woman whose gender identity as women aligns with their female sex assigned at birth ideally produces progesterone as well as estradiol, also known as E2. Therefore, rather than being treated with daily E2 and an anti-androgen as the current clinical practice to follow guidelines, we need to prescribe oral micronized progesterone, referenced to in this article as progesterone, as an at least cyclic component of treatment of all transgender women, gender dysphoric men to women. With the addition of progesterone to E2 therapy, we will highly likely be able to decrease the prevalence of 2 health risks that are now documented to be higher than general population of women or men in transgender women, as currently treated: cardiovascular diseases and low bone density and fracture. So in cisgender women, low progesterone levels can affect these as well, because progesterone, one of the functions of progesterone is in the increase of bone density and the production of bone marrow. Okay, so you can go ahead and read this article in its entirety just to get more of the gist of this research paper. But I'm going to move on and I'm going to talk about oral micronized progesterone's benefits for transgender women. So micronized progesterone is the newest type. It's supposed to have the highest absorbency and it's supposed to be the easiest to absorb in the body. The old style was the medroxyprogesterone, and that one is not used as often. It's usually used as an initial progesterone, which I was on medroxy for about 10 months before I switched to the micronized version. And I currently take 100 milligrams, but a person could take up to 300 milligrams as stated in this article. So the article goes on to say there are at least 3 discrete clinical reasons why they believe, based on their evidence and literature, that progesterone is likely to be beneficial for trans women. So, more rapid feminization. Progesterone competes for the 5-alpha reductase enzyme that converts testosterone into DHT. Thus, progesterone decreases the masculinizing effects of DHT on unwanted male pattern hair. So they're talking about also here the effects on facial hair. The next part that's discussed is progesterone suppression of gonadal androgen production. So progesterone does aid in reducing androgen production. Progesterone feeds back to the hypothalamus, slowing the pulsatility of LH and lowering average LH levels, thus decreasing gonadal T production. Again, this is an action of P4 progesterone to assist anti-androgen therapy in achieving a feminine shape and secondary sex characteristics. Progesterone plus E leads to optimal breast maturation and size. Along with the elimination of facial and male pattern body hair, one of the important goals of transgender women is to develop mature physiological breasts that are classified as Tanner stage 5. However, currently the majority seeks breast augmentation surgery because E2 plus anti-androgen therapy means the areola stays small and masculine, and breasts remain Tanner stage 3. P4 is necessary for the ductal branching within the breast and hence for lactation, and eventual maturation leading to the enlargement of the normal cis woman's areola diameter of 3 centimeters or 2 inches. Currently reviewed evidence is inadequate to assess the breast effects of transgender women's CHT because breast size, not areolar diameter, the primary difference between Tanner 3 and Tanner 5 stages, has so far gone unreported except by one research group. But we do know a lot of us who have been on progesterone for at least a year know that it does affect breast growth. I have had an acceleration in breast growth since being on micronized progesterone, and I believe that anybody who goes on progesterone combined with estrogen therapy will see a significant amount of breast growth within the first year. The next part says progesterone adds to E2 in increasing bone marrow density. Lower BMD is, after CBD, a second major health risk identified in transgender women in long-term CHT. It is unknown yet whether low BMD is related to fractures, as there is only one case report of osteoporotic fractures in a transgender woman. She was a non-smoker but had a strong osteoporosis family history, which in cis woman is related to more rapid bone loss. Progesterone increases bone formation by activating a specific PR on bone-forming osteoblast cells, causing them to increase the number of mature osteoblasts and to increase the process of creating collagen, bone matrix, that is substantially mineralized. A recent meta-analysis assessed BMD change in RCT data in postmenopausal cis women directly, without regard to hysterectomy status, randomized to E therapy alone versus E progestin therapy. Results showed significantly greater spike in BMD gain with EPT than with ET alone. So the research shows that estrogen progesterone therapy does help in bone density, bone marrow density, and bone strength. So it is a major benefit to those of us who are on HRT, and especially with regards to our spine, lower spine and hips. I have seen a serious improvement in my hip joints and lower back since being on micronized progesterone. The next section says progesterone improves sleep and hot flashes. Short sleep durations may occur because of emotional stress, often evoked by gender conflicts, extremely stressful work, alcohol excess, inactivity, and other reasons. Short sleep, less than 6 hours, is associated with negative metabolic changes in CVD, as well as an increased risk for depression. All of these reasons for and consequences of disturbed sleep may be increased in treated transgender women. Progesterone, 300 milligrams at bedtime, significantly improves deep sleep, decreases the time to fall asleep, and decreases mid-sleep waking based on placebo-controlled randomized trials in both cis men and cis women. Progesterone must be given at bedtime to avoid daytime drowsiness because of its sleep-promoting effects. The 300 milligram progesterone dose maintains the P4 blood level in the cis woman's luteal phase range, the desired goal, for the full 24 hours. So progesterone is supposed to help in sleep, and higher doses, it looks like, are way more effective than the lower doses. And one major point in here, which is further down in the effects of progesterone, is that progesterone improves cardiovascular physiology. Heart attack and CVDs are currently increased in treated transgender women, although a recent large case control study showed increased VTE and ischemic stroke, but not acute myocardial infarction. Myocardial infarction. Both E2 and progesterone improve endothelial function, although the endothelial nitric oxide system. Through the endothelial nitric oxide system, progesterone intra-arterially to achieve luteal phase levels significantly increased flow-mediated dilation and was not different from physiological intra-arterial E2. Although E2 effects are not significantly different from vehicle, what they're trying to prove in this section is that cardiovascular, your heart health can be improved by taking progesterone while you're on estrogen therapy, because the estrogen therapy has the ability to affect your heart, cause heart attacks and stroke. So being on progesterone can actually reduce that effect. So then this article goes through some potential progesterone-related adverse or unwanted effects. There is a slight risk of cardiovascular effects that progesterone may cause in people who are more sensitive. Progesterone mood effects. Normally, progesterone is supposed to help to stabilize the mood, but sometimes it can actually cause increases in mood changes, where you can end up being almost like bipolar, where you're depressed one time and then all of a sudden you're a ball of energy right after that. But those cases have been extremely low. Everybody I've talked to who has been taking the micronized progesterone say that their moods are a lot more stable, that they can identify their moods better, and when they do have depression, it's not hormonal related, that it is probably something like low serotonin or something like that. But that's beyond the scope of this video right now. So, and the last point of risk that they list here is people are thinking that progesterone can increase your chances of breast cancer. But after a large-scale investigation into that, it's found that progesterone will likely have the opposite effect. It can actually prevent from getting breast cancer and reduce those cancer effects in those parts of the body that are affected by your HRT. Alright, so I got one more article here from gendergp.com. It's called Progesterone Benefits for Trans Women in Feminization. So here's a chart showing a list of all the benefits of taking progesterone as a trans woman. The first benefit actually states bone density. Using estrogen with progesterone increases bone density in the spine. As I mentioned earlier, I found that my lower back and hips have been improving since I started taking the micronized progesterone. Sleep cycle. According to research, progesterone has a positive impact on sleep, and I mentioned that with the last article that I showed. Estrogen withdrawal. It can improve estrogen withdrawal, improving mood and reducing stress and symptoms. And it says menopause there. So like for a menopausal woman, they will put her on progesterone to try to reduce her menopausal symptoms. And it's without kicking up her estrogen again, but the progesterone does help in the other functions that I've discussed here with regards to bone density and bone marrow density. Male pattern baldness. It says decreases in male pattern hair growth. Now, this article and the other article talk about this as well. And what it's really referring to is this hair, where people who have been experiencing receding hairline, I guess a lot of them go on progesterone to try to prevent that from happening. Progesterone can control testosterone, as I mentioned earlier. So it reduces the amount of testosterone that's absorbed by the body and the amount that it's actually producing. So for anybody with male pattern baldness, it's usually due to too high a testosterone, and taking progesterone will often help with that. And a lot of transgender women who have had issues with thinning hair have seen some improvement in hair thickness and reduction in hair loss after taking progesterone. Not me though. Skincare, reduction in oily skin. So that's one thing that I have noticed too since being on progesterone, is that my skin dries out a lot more. My face isn't as oily as it used to be, so it makes it a lot easier to keep clean. I don't get breakouts as much as I used to. I maybe get one pimple once in a while, like every other month or so I may get one or two pimples. But really they're just small and they go away pretty quick. I have not had a major breakout or oil issue with my face in quite a while. Perspiration, reducing male body odor patterns. So progesterone is supposed to help in changing your sweat glands, and it changes the scent of the sweat that you produce, right? It makes the smell more feminine. Now, I'm still waiting for that. Even after 16 months on progesterone, I'm still waiting for those kind of effects. But I have noticed a lot of other changes, increased feminization. So then the last point on this chart is breast growth, increased breast growth. And yes, it definitely does. Taking progesterone increases prolactin production in the body. And that's literally from the hypothalamus that literally produces hormones for different functions of the body. So that prolactin is what promotes breast growth. And if prolactin levels get too high, that can cause lactation. And it is not unheard of for trans women to have a reaction while taking a type of progestin that affects that, and then they start lactating. All right, so last and certainly not least, I'm going to go through the list of potential side effects of taking progesterone. So this section says progesterone side effects for AMAB people. Progesterone side effects are minimal. Despite this, side effects can occur in some patients. Below, you'll find a list of progesterone side effects. If you experience any of the progesterone side effects listed below in an acute or prolonged manner, please contact a GP or medical professional. Nausea, vomiting, breast pain or tenderness. So the breast pain usually goes along with breast growth, so it's kind of to be expected, but they shouldn't be intensely painful. Fatigue, diarrhea, joint muscle or bone pain, mood swings, irritability, anxiety, sneezing, discharge, coughing, problems urinating, constipation. So, and as it mentioned here, side effects are generally minimal. Most people that I've talked to say that they've experienced 0 side effects, especially the ones on this list. So I am pretty confident. I've been on it for over a year, like I said, 15, 16 months. I've been on the micronized version for going on 7 months now. So I really recommend progesterone to anybody who is considering it. So yeah, and as I've mentioned, progesterone oral comes in 2 forms. The medroxyprogesterone was the original progesterone made back in the 70s. And then within the last couple of decades, we had the micronized progesterone. Medroxyprogesterone is administered in 2.5 milligram tablets, so they're really small tablets, the ones that I was taking. The micronized progesterone come in 2 different forms, either yellow liquid gels like an Advil, or the ones that I have are little white spheres. They look like little white baseballs with no lacings on them. And those are 100 milligrams a piece. Both of those pills are 100 milligrams. You can also get progesterone in a transdermal patch, but the patches really aren't as common. And usually a person would be prescribed patches for progesterone only if the micronized progesterone is rejected from their body. Then they would recommend moving to patches. But because I'm on patches for estradiol, going on patches for progesterone would not be a great idea because I just don't have enough surface area on my body to wear that many patches. But once again, I do highly recommend anybody getting on progesterone. There are a number of other effects that some people do experience, like increased libido is a thing that a lot of people do experience, and that's one thing that wasn't listed in any of these articles. So, and that's one thing that I experienced definitely, especially on micronized, is an increased libido. And I don't know, it's kind of nice, I guess, you know, especially for someone like me who's a non-op trans woman. I would like to preserve what I have. Alright, well, thanks for watching my video. Make sure you smash that thumbs up button down below and drop me a comment. If you have any other questions about progesterone on stuff that I haven't talked about, make sure you drop your comments. If you are a trans person and you've been taking progesterone, make sure you comment and talk about your experiences on progesterone. Or if you're a trans person considering progesterone, make sure you drop your questions in the comments below. And make sure you come back for my next episode. I'll see you then. Bye!